if you give any patient one tablet to be taken once a day, the compliance is 76%. Did you now get this correct? If I ask you to take one tablet every day faithfully, 24% of you will forget it. One day or the other you forget. But when it becomes 2 tablets to be taken twice a day, the compliance is 46%. When it is more than 3 tablets per day, the compliance is 23%. Did you get it? That means 77% of the people do not take regularly drugs prescribed if there are more 3 drugs in the laundry list that we always give. But today, 3 drugs is very rare. About 13, 14, 15, 18, 19 drugs. So you can imagine what percentage of them take the drugs. Now I'll give you the side effects of the drugs. Adverse drug reaction is the commonest of death in America. America is the only country where there are good statistics kept. 4 jumbo jet load of human beings die every month due to adverse drug reactions, ADR. In last year, 1 million people, that is 10 lakhs Americans, America's whole population is about 1/4 of Indian population. You can imagine that, 300 million. Out of the 300 million, 1 million died of adverse drug reactions. 79 million people got admitted to the hospital because of adverse drug reactions but did not die. This is the number that we are aiming to increase, because these 79 million people who came with drug reactions are the people who got the hospital industry $80 billion profit. Just imagine that. So, an Indian doctor in America, a surgeon, has written a book on how surgery happens and how to reduce surgical deaths. In that he says, very interestingly, he says that if you probably don't have complications after surgery, many of the hospitals will have to close because their biggest income is surgical complication. I do an operation, let us say I remove the appendix, and the patient goes home after that without anything. I may get some dollars, say maybe $5,000, $10,000, $20,000. Suppose he comes back with the complications several times and needs more and more operations, my income will be enormous. So the hospitals want more complications after surgery. Hospitals want more drug reactions so that they can treat more people. But that's okay. I don't mind they're making money. But I'm worried about people who are sent to meet their maker in heaven by the drugs. Now this, in my calculation, now if you put the 2 calculations together, 77% of the people do not take the drugs that doctors have given. Supposing all of them had taken it, what would be the number that of adverse drug reactions? See, 23% is 1 million. That is 4 jumbo jets every month. Supposing 100% them took it, you require 10 jumbo jets every month dying. If 1 jumbo jet falls, 1 small jet falls near Agra, 4 people die. It's been news in every paper and every television. Day before yesterday, one of our Air Force jets fell down. Now every month 4 jets fall down, no paper writes it. Common man doesn't get to read it. And today it is so difficult to convince people not to take drugs. People want drugs. Even if there is a good doctor, there are a lot of good doctors, let me tell you. In all systems of medicine, there are actually majority of doctors are good human beings. There's only a microscopic minority of bad elements who give the system a bad name. Now, these good doctors sometimes don't want to give drugs, but the patients demand drugs. The mother comes with a child which has a common cold. A sensible doctor says, treated cold lasts for 7 days, untreated for more than a week. So, then the mother says, no, you give an antibiotic. My child has to go to school tomorrow. He has got an exam. The teacher will be angry. Now the doctor is forced to give antibiotics, okay, even if he doesn't want it. Now, what happens if you give antibiotics to a viral disease? Antibiotics cannot kill viruses. Antibiotics change the immune system response to the viral disease. Now, as Venkatraman said, my book says there is a good doctor inside. I'll tell about him or her later. But this doctor tries to cure you in most cases. Now there is a response from the immune system, which is called a cytokine response of T1, which cures the common cold by itself. Now, the minute you give antibiotics, that gets changed to T2, which means it produces vasospasm, it produces bronchospasm. We are manufacturing asthma in the society. The incidence of asthma has gone up so much, death rate due to asthma has gone up so much, that today asthma has become a big problem. I still remember in the 50s when we were students, our textbooks used to say, asthma is a very mild disease, nothing to worry about it. Asthmatics are protected against tuberculosis. So if you are an asthmatic in our time, it was good because you don't get tuberculosis. The dreaded disease was tuberculosis. Today, asthmatics have more tuberculosis than non-asthmatics. Because we give so much of steroids to asthmatics, which depresses the immune system, and TB germs are in our air. So you become a TB patient. Now, there's a very interesting new development. They want every human being to take TB drugs. Somebody was telling me day before yesterday, which I don't know, I'm not confirmed yet. Rotary organization has now left polio. They were after polio for a long time. I used to tell them, do you know anything about polio? They don't know. They're Rotarians. Then why do you want to get involved with that? They don't know. Now they are getting involved with tuberculosis, I'm told. And for the Rotary organization, Rotary, they are now telling, I believe, all human beings must take anti-tubercular drugs. Anti-tubercular drugs are such powerful antibiotics. And I only pray God that better wisdom prevails on the Rotarians and others, that everybody should not be drugged. Now there's a move in America to put statins into water supply. So everybody's cholesterol is brought down. So that more cancer can be produced, because if you don't, your cholesterol is produced in your own body. And your body is not foolish to produce cholesterol unnecessarily. Only when it is needed, it produces. Supposing, your cholesterol and my cholesterol cannot be the same, because we are not the same. Your own brother's cholesterol and your cholesterol cannot be same. Your own twin's cholesterol and your cholesterol need not be same, because you are not same. So why make everybody same? This is the biggest curse in medical science. We don't know. I don't know what my blood pressure should be. What is normal blood pressure? I don't know. Mahatma Gandhi's blood pressure is 200 by 120 all his life. And the person who was not sleeping was Sushila Nair, his doctor. She has written in her autobiography. The old man was sleeping. And he was killed by blood pressure complications. There's a bullet from Nathuram Godse. See, this is what we do. And I have a very famous doctor in Bangalore. I don't tell the name. You all know him. His blood pressure is always 90 by 40. And he comes to me and says, give me some drug. I said, look, you will live forever. Why worry about it? Nature wanted your blood pressure to be that much. And you are a neurosurgeon. You operate for 12 hours standing. And why are you worried? You are alive. And you will be alive. And thank God he's still alive. He's about 92. So what happens is, now what do? We take the average. Now chartered accountants here. What we do is average blood pressure of human beings. That's a Gaussian curve, mean plus 2 standard deviation. And that we call as normal. Average is converted into normal. Now this is done not without any reason. When you convert an average into a normal, you get about 25% false positives and false negatives. So about 25% of people who are normal become abnormal. I'll give you an example if you're not understood, because it's complicated statistics, some of the younger generation. What is the average height of Indian male? Gaussian curve, plus minus 2, that's 5.4 inches plus minus 2 inches. So if you're between 5.2 inches and 5.6 inches, you're normal. Did you understand? You're average. Now, what do we do? If you're not normal, we treat you, right? Agreed? If your blood pressure is not normal, you treat. If your height is not normal, we'll treat you. Amitabh Bachchan comes for a common checkup. 6.2, what is the treatment? Cut his leg, make him 5.6. That's exactly what we do. Jaya Bachchan comes for a checkup, 4.6. Transplant that leg to her, she also becomes normal. This is a curse. So friends, I jokingly tell people, don't take it very seriously. If you want health, don't go to the medical establishment. Whether it's homeopathy, umapathy, ajurupathy, allopathy, no pathy. If you want honor, don't go to the police.